Welcome to the Deep Dive, where we cut through the noise to bring you the clearest insights. Today we're diving into athlete burnout. You might think of it as simply, feeling tired, but it's actually a really profound issue, impacting mental and physical well-being in pretty complex ways. Our focus today is on a really important new systematic review and meta-analysis. It's by Glandorf, Madigan, Kavanagh, and Mallinson-Howard. And it's the first study of its kind to really comprehensively examine how athlete burnout connects to, well, a whole range of health outcomes.
Yeah, and what's really striking here is the scale, right? This study pulls together findings from 54 different research papers. We're talking data from nearly 14,000 athletes. So our mission today is to unpack the key insights from this huge piece of work. How does burnout genuinely impact an athlete's health? What are maybe the surprising parts, and what does this actually mean for you? Whether you're an athlete yourself, a coach, or involved in sports organizations.
Okay, so let's start at the beginning then. What exactly is athlete burnout? Is it just being exhausted?
Well, no, in sports, burnout isn't just fatigue. It's a specific psychological syndrome. It's got three core symptoms. First, there's physical and emotional exhaustion, that feeling of being utterly drained, just overextended.
Okay, makes sense.
Second, you see devaluation. That's like a negative, almost cynical attitude towards your sport. Losing that passion.
Right, like what's the point?
Exactly. And finally, there's a reduced sense of athletic accomplishment. An athlete starts feeling less competent or successful, maybe even if their performance hasn't actually dropped much. It's a chronic thing, a pervasive issue, not just, a bad week at training.
Okay, that definition really helps. So if an athlete is experiencing these profound symptoms, what's happening to their mental health?
Yeah.
Did this big study confirm what we might kind of suspect?
It absolutely did. And it put numbers on it, too. The systematic review showed that athlete burnout is, consistently linked to a clear increase in negative mental health outcomes. And at the same time, a decrease in the positive ones.
Right. Let's dig into those negative outcomes a bit more. What specific issues did the researchers really find strong links with?
Okay, so for negative mental health, they found strong connections between burnout and increased depression, anxiety, problems sleeping like insomnia, excessive worry, and even things like body image dissatisfaction.
Wow.
Yeah. And for instance, the meta-analysis part, where they crunched the numbers from multiple studies, found a medium effect size for the link between burnout and both depression and anxiety.
Medium effect size.
Yeah.
So that means it's a pretty noticeable connection, not just random.
Exactly. Think of effect size as how strong or meaningful that link is. Medium means it's clear, it's noticeable, it's an important connection, definitely not just a weak correlation. That might be chance.
Okay. And what about the positive side of mental health? Did burnout chip away at those too?
Yes, definitely. Burnout was negatively correlated with those positive outcomes. So we're talking about a significant drop in satisfaction, and that covers life satisfaction, team satisfaction, performance satisfaction.
So across the board, really?
Yeah, pretty much. Also, a reduction in subjective vitality, that's your sort of feeling of energy and aliveness, and just a lower overall quality of life. And again, the meta-analysis showed medium effect sizes for satisfaction and vitality. So a substantial negative impact there, too.
So what does this really tell us then about the experience of an athlete dealing with this? It's clearly way beyond just winning or losing, isn't it? It's hitting their fundamental well-being.
Absolutely. And, this brings up that really important question of cause and effect. Does burnout cause these mental health issues, or do the mental health issues lead to burnout? Or maybe both?
Right, the chicken and egg problem.
Exactly. And the study looked at longitudinal designs, which really help here. Longitudinal means they tracked athletes over time, which gives you a much better sense of how things develop compared to just taking a snapshot at one point in time.
Ah, okay. So what did tracking them over time show?
Well, several studies showed burnout predicting things like increased depression and insomnia later on. So burnout came first in those cases. But interestingly, for depression, one study even found it could go both ways, what they call reciprocal effects, meaning depression could also predict burnout later. It can become a kind of vicious cycle.
Oh, wow. That's complex.
It is. But then for insomnia, it seemed more one way. Burnout predicted poor sleep, but poor sleep quality didn't necessarily predict burnout later on. So these relationships can be quite nuanced.
Okay, that's fascinating. So we've talked a lot about mental health. Let's switch gears a bit. What about the body? How does burnout actually, show up physically in athletes?
Yeah, this is where the picture gets a little more mixed, perhaps. Well, research in, say, occupational settings like regular jobs often shows clear physical links. The evidence in athletes, while it's there, isn't quite as consistently clear-cut across all the different ways they tried to measure it.
Okay, so what were the most consistent physical findings then? What did show up clearly?
The most consistent thing for physical health was a definite positive correlation between athlete burnout and physical or somatic symptoms.
Somatic symptoms. What does that mean exactly?
It's things like headaches, maybe chest pain, dizziness, the kind of general bodily complaints that don't always have a clear medical cause, but they feel very real to the person experiencing them.
Right, like your body's just feeling off.
Exactly. And the meta-analysis for these physical symptoms also showed a medium effect size. So that connection seems pretty robust. Burnout often comes with feeling physically unwell in these ways.
But for other, maybe deeper physical markers, it wasn't as straightforward. You said it was mixed.
Precisely. When they looked at things like physiological markers, stress hormones like cortisol, or indicators from the immune system, or even basic stuff like heart rate, breathing rate, brain activity recordings, the findings were surprisingly mixed across the different studies.
Huh. So you might expect, say, stressed out, burned out athletes to have consistently high cortisol, but that wasn't necessarily the case.
Not consistently, no. Cortisol was looked at a lot, but there wasn't a clear, reliable pattern linking it to burnout levels in athletes across the board. Same for many of the immune markers and other physiological measures. It suggests that while the mental experience of burnout has clear physical symptoms, those somatic complaints finding a consistent, measurable, biological signature of burnout using these specific tests, well, it's proving trickier in athletes than maybe we thought. It's complex.
Okay, that's really interesting.
Yeah.
What about injuries then? It just feels kind of intuitive that if you're burned out, exhausted, maybe less focused, you get injured more often.
Yeah.
What did the study find there, especially with those nuances you mentioned?
Yeah, that's a great question. And you're right, it feels intuitive. The study did find a small positive correlation between burnout and injury, so there is some link.
Small, though.
Small, yeah. But here's where it gets really interesting and kind of turns that intuition on its head a bit. Some studies actually found that athletes who were injured reported lower levels of exhaustion and a greater sense of accomplishment after they got injured.
Wait, lower exhaustion after an injury. How does that work?
It's puzzling, right? It really highlights the complexity.
Yeah.
Maybe the injury forces a break that the athlete desperately needed but couldn't take otherwise, or perhaps the kind of athlete who pushes themselves to the point of injury has a different psychological profile, maybe higher drive, that interacts differently with burnout concepts compared to someone who burns out without a specific injury.
Ah.
It definitely tells us it's not a simple one-way street where burnout just leads to more injuries. The relationship is clearly more complicated, and maybe we need to rethink how we connect burnout specifically to physical harm versus just general physical symptoms.
Okay, so given all this, the really strong links to mental health, the consistent reports of physical symptoms like headaches, but then these less clear or even surprising findings around physiological markers and injuries, what are the big takeaways? What are the practical implications of this research for athletes, coaches, sports organizations right now?
Yeah, connecting this to the bigger picture. These findings really hammer home that burnout needs to be taken seriously. It should be a priority, especially given its profound impact on overall health, which, ultimately affects performance too. And there's another point they raise, the healthy participant problem. Athletes who are really struggling with burnout might drop out of sport altogether, so they often don't even end up in these studies.
Ah, so the real impact might actually be even worse than what the studies show.
It's quite possible, yeah. The true prevalence and impact could be underestimated because the most affected individuals might be missing from the data.
So if it needs to be a priority, what does that look like in practice? How can teams or organizations actually address this?
Well, it strongly suggests there's a real need to include burnout monitoring as part of systematic athlete well-being programs. Maybe integrate screening or check-ins into the roles of people already there, like sports psychologists or dedicated well-being officers. The World Health Organization already recognizes burnout as an occupational phenomenon in general work contexts. This research basically reinforces how crucial it is to apply that thinking within sports policy, too.
Okay, monitoring makes sense. What about actually preventing it or treating it if it happens? What kind of steps can be taken?
That's key, of course. While we definitely need more research focused specifically on interventions in sport, we can learn a lot from the broader occupational literature burnout and other high-pressure jobs. And that literature generally suggests that a combination approach is best. You need personal-level interventions.
Like therapy?
Yeah, things like cognitive behavioral therapy or maybe social emotional learning programs to help athletes build coping skills, manage stress, that kind of thing. But crucially, you also need organizational level interventions. You can't just put all the pressure on the individual athlete to cope.
Right. Changing the environment itself.
Exactly. Things like looking at training load management, adjusting external pressures where possible, maybe providing psychoeducation for the whole team and staff so everyone understands burnout better. Combining those personal and organizational strategies seems to offer the most effective, most holistic support.
And looking ahead, the authors pointed out some areas where more research is really needed, right?
Yeah.
What's next for understanding athlete burnout?
Yes, definitely. There's a strong call for more longitudinal studies. We need more research that doesn't just take a snapshot, but actually tracks athletes over whole seasons, maybe even into the off season or post-career.
To see how things really unfold over time.
Precisely. To understand those long-term effects and that interplay, that back and forth between burnout and health outcomes, they also really emphasize needing to explore those psychophysiological pathways more deeply. So systematically looking at biological markers, maybe linked to specific bodily systems to figure out the how does burnout translate into these physical feelings or potential long-term health issues? And importantly, trying to differentiate the biology of chronic burnout from just, acute stress responses.
Okay, so this deep dive really shows that athlete burnout is, well, it's far more than just feeling tired, isn't it? It's clearly a significant mental health issue with very real, tangible negative impacts across an athlete's life. And its relationship with physical health is complex, sometimes surprising, but definitely there, especially with those general physical symptoms.
Absolutely. It's a powerful reminder that an athlete's health, their whole health, mental and physical, is just fundamental. It underpins their ability to function, to perform, sure, but also just to lead a happy, productive life long after their sporting career might end.
So here's a final thought for you, the listener, to maybe chew on. If we now understand that burnout can be both a cause and an effect in an athlete's health journey, sometimes even cycling back on itself, what deeper responsibility do sports organizations, coaches, support systems really have? Is it enough to focus just on peak performance? Or do they need to truly prioritize holistic well-being throughout an athlete's entire career and maybe even think about support beyond that? It's definitely a conversation that needs to keep going and probably needs to evolve quite a bit.